Good afternoon. Instead of the typical PIC weekly, I'd like to do a short video. I know this week feels heavy. We're being stretched thin. We're leaning in and working more. The time that we normally do laundry, go to the dentist, connect with friends, or even take a moment to breathe is being cut short. It's been hard on me, and I'm sure it's hard on you too. But I have a story to share if you have just a moment. Growing up in Lexington, Massachusetts, we learn about the American Revolution at a very early age. And indeed, the most enduring part of American medicine was born from times similar to this, when something extraordinary came out of exhaustion. So, in the winter of 1777, it's the middle of the American Revolution. There were no hospitals. Soldiers slept on straw that reeked of sweat and smoke. They were freezing, they were hungry, they were sick. Infection was everywhere. In fact, infection killed more people than British bullets. So, soldiers wrapped rags around their bare feet because shoes at that point had completely disintegrated. And amidst that misery, a small group of doctors, led by Dr. Benjamin Rush and others, refused to look away. They took over barns, churches, and schoolhouses and turned them into makeshift hospitals. Now, they didn't fully understand infection, and penicillin was 150 years away, but they learned how to systemically treat a large group of people. They organized supplies, they created first systems of triage, they demanded fresh air, clean bedding, and decent food for their patients. And they noticed that those things helped. They trained helpers who would be the first nurses and medics. Out of that chaos came America's first medical infrastructure, the foundation for military and public health medicine as we know it, perhaps even a precursor for Kaiser Permanente. And it was born not from comfort, but from chaos. So when I look around this week, I see the same spirit. We're tired, yes, but we are adaptive, we are creative, we're showing up for our patients and each other, and we're proving that care isn't about having perfect conditions. It's about refusing to let hardships define us. Even in this hardship of this week, new workflows are being explored, which are probably going to help us going forward for years. So thank you. Thank you for your hard work, for your perseverance, and for your strength. I appreciate you for being part of OTI One.